The basal metabolic panel are few values of electrolytes and other molecules that are very important, and we use them all the time in the ED. The first and most important is of course glucose. The first thing that you need to check for your patients is of course glucose levels. If glucose was too low, the patient is expected to have symptoms that are similar to beta blockers toxicity. So the patient will be sedated, with low consciousness, and high levels of confusion, which is a frequent presentation of patients in the ED. And of course, if glucose was too high, it can also indicate problems relating to diabetes mellitus, like the hyperosmolar hyperglycemic state. Calcium is also important because its function and its values is very limited. It should be between 8.5 till 10 or 10.2. So a deviation from this narrow window can produce some symptoms like abdominal pain, fatigue, and confusion. Sodium is also very important. It basically indicates the hydration level of the patient, and it can explain symptoms that are mostly neurological. Potassium, just like calcium, has a very narrow window, from 3.5 till 5. If it's too high or too low, it can affect the heart and cause arrhythmia. Chloride, while it does have some narrow window, it doesn't really produce a lot of symptoms like sodium and potassium. The blood urea nitrogen and the creatinine both indicate the renal function, and they are very important especially in patients who are dehydrated, because they can be elevated if the patient is dehydrated. And you need to have these levels within normal level to give the patient IV contrast or to use any medication that might affect the kidneys. This lecture is part of the emergency medicine course. If you find it useful, you can check out the entire course in the link in the description. The course covers everything that has to do with the emergency department, including tests, imaging studies, common cases, and serious conditions. We also have a lot of cases and quizzes that you can take to test your knowledge. Just check the link in the description.